This has been a really great conversation already, and I'm glad to be a part of it and share my little piece of the puzzle that we're all trying to figure out together. My name is Leticia Bode. I'm a researcher and faculty member at Georgetown University. All of the research I'm sharing today is co-authored with Emily Braga, who is a professor at the University of Minnesota. And if you are interested in any of this, feel free to ping me on Twitter or send me an email, and I'm happy to share more information about what I'm talking about today. I'm going to try to condense 3 studies into 10 minutes, so it's only going to be the highlights. So what I'm sharing about today is roughly 3 studies and a research agenda that's been going on for about 6 years now, looking at how we might be able to correct information, specifically health misinformation on social media. The studies I'm highlighting today are looking specifically at the Zika outbreak a few years ago. Obviously, the caveat being here that the Zika outbreak was much less widespread than the current pandemic that we're dealing with, and all of our studies took place in the United States, where it was relatively low salience and lower threat compared to what we're dealing with right now. So your mileage may vary, as they say. Okay, so my focus is specifically on social media. You've heard a lot about social media today already, so I won't spend a lot of time talking about this in terms of background. Over the course of our research agenda, we've looked at 4 different platforms. So when I talk about social media, this is roughly what I have in mind. Most of them have looked at Facebook or Twitter. We also have a couple studies that look at Instagram and video platforms. And our effects are pretty consistent across social media platforms. So as people have told you already today, as you all already know, social media can disseminate misinformation very effectively. There aren't a lot of established gatekeepers, which means that nobody is protecting information in the same way that we might have seen in the traditional mass media. There's also an ability to self-select into communities. So people that are interested in particular aspects of misinformation can find like-minded others. A classic example of this is the anti-vaccine movement, which it has a very powerful and insular community online. And as, of course, one of the points of social media is to allow for rapid information transmission. So it's really hard to get a handle on things that are moving so quickly, as has been highlighted by some of the research you've already heard about today. But what my research looks at is whether social media can also serve as a source of correction of misinformation. And we think there are several reasons that that might work. Number 1 is what we call observational correction. So as you heard about in the last presentation, in terms of people that you're affected by, people that you interacted with in the offline world, it's a relatively small number. It's usually quoted as about 100 people. Whereas the average person on Facebook has about 700 friends. The average person on Twitter has about 300 followers. So we're dealing with a lot more people, which gives an opportunity for those people who are on social media to watch other people getting corrected. So if I see a friend share misinformation and I put a comment on their post that says, this isn't true, let me tell you why, it's not just my friend that gets that information. My friend might actually be mad at me for correcting them, but all of the people that are following my friend or friends with my friend get to watch that as well. Importantly, that happens immediately, or can happen immediately, which is to say, whoever is watching my friend post that information also gets to see my correction right at the same time in the same place. And we know from other research on correction of information that the closer together the misinformation comes to the correction, the more likely the correction is to be effective. Additionally, partly because networks are so large on social media, they tend to be more heterogeneous than offline networks. So you stay in touch with people in social media that you probably haven't seen in decades, right? I think I'm friends with someone that I literally worked with for like a week in high school on social media. That is not a person that is an active person in my life, but that's a person that is a person that I'm exposed to on Facebook, and weak ties in general are going to provide more opportunities for diverse information than strong ties. So that gives another opportunity for corrective information to be introduced. So to give you a sense of what our research looks like, this is an example from our Zico research. In this case, we're looking at the Twitter platform. And you can see on the top, there's just a generic post. This is basically embedded in what we call a simulated feed. So there are a bunch of posts that are just kind of generic posts. And then at some point they're exposed to, in this case, right in the middle, a piece of misinformation, and then they are either, some people experimentally are either shown a correction to that misinformation or they're not shown a correction to that misinformation. And additionally, we vary different aspects of the corrective information, including the source, who it's coming from, as well as the kind of type of correction that people engage in, whether they're including relevant information, if they're including a link, what kinds of rhetoric they're using, how civil they are in their approach. So lots of different aspects of that get manipulated. I obviously don't have time to talk about all of them in depth, but I want to give you just kind of an overview of what we find. So the broad conclusion that we have found consistently in every study that we've done is that this kind of corrective action works on social media. And broadly speaking, our findings are anywhere between 10 and 25% reduction in what we call misperceptions, which is a belief in the misinformation, the relevant misinformation that we're testing. Importantly, particularly for this particular conversation, expert organizations like the WHO or the CDC in the United States are the most effective correctors. So we find larger effects with expert organizations directly correcting people on social media, and they only have to correct once. Sometimes we find that we need multiple corrections for them to be effective. That's not true for experts. One correction is effective. Importantly, we don't find any reputational cost for expert organizations doing this. So we think this is really important because anecdotally, it seems like organizations are hesitant to engage too much directly with users on social media because they think that it's inappropriate, or it will be perceived as inappropriate, or they'll get trolled, or those sorts of things. In general, people have the same perception of the expert organization before and after they're exposed to the correction from that organization. Platforms can also correct. So there's a study that we did in 2015 where we looked at the related stories function in Facebook and saw whether that could, if the related stories included corrective information, if that was effective at improving this, reducing misperceptions, and we found that it did. Currently, as you heard before from the folks at Facebook, they generally use journalistic fact checkers. So they have a network around the world of people, mostly through the International Fact Checking Network, that engage in this correction. Obviously, that is somewhat limited and mostly does not include health organizations, which means the type of information that gets corrected is not always health information. So that is worth noting, that is another area where potentially this can take place. Importantly, users can also correct one another. So just average social media users, even people that the people in our experiments don't know who the people are, they're just anonymous other users, can achieve the same effects, especially when they include a link to an expert organization. So if we compare a message that has a link to the WHO or the CDC and a message that does not, the one with the link is effective, the one without the link tends not to be effective. So users have to give some kind of credibility cue that they know what they're talking about, that this is information-based, in order for it to have its intended effect. So our main takeaways for the purposes of this conversation is, first of all, social media can be an effective conduit of misinformation correction. We think that's really important to keep in mind. I think social media is often demonized as a purveyor of misinformation. Thinking about how we can use it as a mitigator of misinformation is really important. And there are a variety of roles that expert health organizations like the WHO can play, including correcting people directly, providing the public with clear, easily digestible, easily shareable information. I think the Mythbuster series is along these lines, but could go even farther in doing exactly that. And then partnering with platforms, which obviously, as we already heard today, is happening, but there's still a lot of opportunity to improve and expand that kind of partnership. So I will stop there.